focus on offering that educational content. Kind of like Jen just said, maybe it's chair exercises. Maybe it's something to keep the body in motion. Maybe it's partnering with a local vendor and doing, tips to make a healthy smoothie. Maybe it's, what you can do to clean your ears out properly so that you've got better hearing. It's anything that kind of doesn't say, hey, by the way, audience, you're getting old, but instead it says, hey, audience, here's how you can look and feel your best.
Yep, absolutely. I think another great way to do it is refer to the research. Research shows us that if you're eating well, or you're paying attention to your diet, or you're staying in motion, that is all going to prolong your health. So becoming that expert, showing that you're that expert, and referring back to the data that proves it.
Hey there, welcome to the Dr. Marketing Show. I am Jennifer.
I also am Jennifer.
And today we're going to talk about longevity and healthy aging, but not just so much about getting older and this anti-aging kind of phenomenon and trend that's going on, but really just about how we can market to a consumer that has a different mindset now than they might have had in past years. And so longevity and healthy aging have become key topics of interest, with conversations about staying active and healthy increasing by 12%. Consumers are focusing not only on extending their lifespan, but also enhancing their health span, the years they remain physically and mentally fit. Unlike traditional anti-aging, which emphasizes appearance, this new trend centers on overall health and quality of life. Sounds familiar, right, Jen?
Yes.
So popular approaches include regular exercise, a balanced diet, sleep, and supplements, with walking seeing a 22% rise in mentions online as a beneficial activity. Healthcare brands can contribute by offering educational content on exercise, nutrition, and sleep, and by partnering with wellness influencers to engage consumers eager to live healthier, longer lives. And I think it boils down to a conversation we've been having offline, and that is that, today's consumers or today's patients approach this aging thing very differently than maybe our parents or grandparents did.
Absolutely. Our parents and grandparents treated the symptoms. So they would be prescribed medications or things to treat the actual symptoms. If I'm not sleeping, well, give me an Ambien. If I'm, don't have enough energy, or I have brain fog, well, you must have ADHD, so you need to be on Adderall. Whatever the case may be. Now, you have a different age group or a different demographic that's wanting to figure out what's causing all of this. Is my gut health affecting my inflammation in my entire body that's causing the joint pain, the foggy brain, the, fatigue, all of it? They want to figure out how to stop it completely. And whether that's changing your diet or exercising in a different way, it's just a completely different way of looking at it.
So I think from a marketing perspective, let's say your practice is orthopedic, because we do a lot of ortho. I don't think you can go straight into marketing, or making, like, the measurement may not be how many surgeries that you do, because this group doesn't want to just go to surgery. Whereas my mother or my grandfather, if their knee was bothering them, they may go straight to surgery because they're just going to get it over with. They're going to rip the Band-Aid off. Whereas this younger generation, probably not me, maybe you, maybe not me, maybe it's like the group under me, they're going to want to say, hold on a second, I want to lose the weight that takes the pressure off the joint before I'm even going to consider surgery. And whereas my generation may be more prone to taking a pill to lose the weight, I think the younger folks, yes, they'll take the pills to lose the weight, but they're more interested in the lifestyle changes directly related to losing the weight. So from a marketing perspective, how can we make those changes and not focus on the surgery as much, but focus on the root cause? And so maybe your blogs or something like that, maybe they're not about, the differences between total versus partial knee replacement. Maybe your blogs are 5 exercises that you can do to keep a healthy weight.
Absolutely. Diet as well. A lot of things are out there right now. If you look at it again from an orthopedic perspective, inflammation is the cause of so many things. It's before, I think it was always, oh, you have arthritis in your finger, that's why it hurts, and that's why your joint hurts. You might have rheumatoid arthritis. Well, now there's so many things in your actual food, in your diet, that can be changed that will eliminate that inflammation. So I think it's talking about those healthy diet changes, or even exercises. If you're, what do they say? A healthy body is one that's in motion. Give great exercises, even if you're talking to an elderly, group. Just getting up and down out of your chair, and, when you're sitting, pretend like you're riding the bike when you're sitting down. There's so many different ways to educate and still staying within your specialty.
All right, so I think that it goes to, how can healthcare brands contribute to this conversation, this anti-aging or aging well, or whatever we want to call it, conversation, because it really does apply to all brands. Mm-hmm. So the very first thing I think your medical practice can do is focus on offering that educational content. Kind of like Jen just said, maybe it's chair exercises. Maybe it's something to keep the body in motion. Maybe it's partnering with a local vendor and doing, tips to make a healthy smoothie. Maybe it's, what you can do to clean your ears out properly so that you've got better hearing. It's anything that kind of doesn't say, hey, by the way, audience, you're getting old, but instead it says, hey, audience, here's how you can look and feel your best.
Yep, absolutely. I think another great way to do it is refer to the research. Research shows us that if you're eating well, or you're paying attention to your diet, or you're staying in motion, that is all going to prolong your health. So becoming that expert, showing that you're that expert, and referring back to the data that proves it.
Funny, we just had a conversation yesterday with an ortho group that is looking to increase some of their ancillary services. And so we're looking at what we can do with internal marketing to kind of help with outcomes and market other areas of the practice. And so we're using the lobby TVs to highlight research that shows when you do X amount of PT appointments post-surgery, that you have a higher likelihood of regaining, 80% range of motion versus 20% if you're doing your PT at home. And we're using that data to reinforce it, and we're using it in the PT rooms so that folks will continue using PT and not think that, I can just do this PT at home. So I think you're right. You lean into the data to do it. Another thing I think you could do to help really position yourself as the expert and kind of the owner of the education is you can partner with influencers. I'm not talking about influencers that can be kind of daunting or like scary just to even try, like online influencers. I'm talking about really like simple stuff in your community. So I have a practice, another ortho example, and they were looking to show to focus on back stretches. And so they partnered with a local PT who does specific back stretches or exercises for golf. And so we went over there with the cameras and we shot a whole bunch of videos just for social media, demonstrating the proper golf swing, what it does to your back, and then the exercises that they could use to counter any of the ailments that would come from those golf swings. And we got a ton of engagement from it, one influencer to another, kind of ortho adjacent, and it worked from a marketing perspective. And I think if you want to position yourself as the expert, find other people who are the expert and go out there and use both of your audiences to reach more people together.
Absolutely, absolutely. I actually went into a practice, not to use another example, but there's a new fruit smoothie place that is opening in my community, in my area. And they were at the OBGYN offices giving samples of their acai bowls. And inside of there, they had a little card, and on that card, it gave all of the different kind of gut healthy ways that this smoothie once a week would help with. It was really a very clever way to show that A, you're part of the community and supporting other, businesses around you, but B, also telling your patients, hey, look, yes, you can do X, Y, or Z from a medical perspective, from a taking a prescription, but there's also a lot that you can do on your own. And here are some of those little things: eating your greens every day, and watching your carbs, and making sure you get enough protein, and the protein and how it affects your bone health. Educating them in a different way. Everybody was sitting in the waiting room raving about the smoothies, and have you tried this one, and have you tried that one? It was really, and it also didn't make you realize that you were waiting in the waiting room, but it was very educational, and I thought a very nice way to get the information
So we're
out.
talking about this stuff because there's a recent consumer report that came out that's discussing how trends in consumer health trends related to the decision-making process within healthcare. And McKinsey & Company also has said recently that if you showcase your brand's expertise and commitment to supporting long-term health, you can do this by creating the right kind of campaigns that are addressing those healthy aging practices. And so I was thinking about this. We have a new client. It's an MD. She owns a med spa, and she's very focused on, information about the fillers, and information about hormone replacement, and information about Botox and how to choose the right Botox, and information about anti-aging. But I think if you go back and look at what McKinsey & Company is saying, is that don't approach it by highlighting Juvederm or highlighting Botox or whatever the latest treatment is, or highlighting weight loss. Focus on anti-aging. I say that in air quotes. Focus on aging right, and how you can use something like what you were just saying, like eating clean, and how that impacts your skin. Or, keeping your body in motion and how that impacts your inflammation and things of that nature. And focus on, like you said, the root cause to these issues. That's a way to market your practice. Very different than the way that every other anti-aging clinic is marketing. But this consumer is much more savvy, much more on it. And if you listen to the episode that we did where we're talking about women's health in particular and women as decision makers in healthcare, we are more focused on doing the research, engaging in the conversations. And so the marketing has to also meet us where we are, which is making sure that we're focused on the underlying issues.
Absolutely. And there's so many things that I think from an educational standpoint that are intertwined. And the more you educate, the more you build that trust level. And once you have that trust, they're going to go to you with pretty much everything. So trust is super important. And I think in this day and age when everything online you're questioning, is that AI, is that real? And building that trust with solid educational information that again does treat that root cause is super, super important.
Yep. So with that, I'm Jennifer.
And I'm Jennifer.
And we'll see you next time on the Dr. Marketing Tips Show. Thanks a bunch.
Bye.
If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out. And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.